This is an outreach activity of the Executive Master in Disaster Risk and Crisis Management from the country's premier graduate school for business and management, the Asian Institute of Management. My name is Wally Panganiban, a proud member of the pioneering batch of the emdrcm, and today, for our very first episode, we're very happy to have with us the program director for emdrcm and the school head of the Stephen Swillig School of Development Management, Dr. Kenneth Hartigan.
Hello, Wally. Thank you very much. Happy to be here.
I know that you're a very busy person, and this means a lot to us that you are spending time to do this.
No, but it's part of our social responsibility to share information.
Maybe you'd like to tell them about the emdrcm program before we go deep dive into the topic.
All right. Thank you, Wally, for this opportunity. I work in the Asian Institute of Management. As you know, this institution has been here for the last 52 years. And what we do here is to create leadership and management educational platform, and but also to not just teach it, but to bring certain value to society. Now, we are agile, we are innovating, and we have now a new program which started this last year, which is the Executive Master's Disaster Risk and Crisis Management. Now, why did we set up this new program? We felt that disasters are coming, natural calamities, man-made crises, issues that affect society, climate change. They're going to be more and more serious, and we need to create layers of leaders who are able to make executive decisions, collaborate, work together during crisis times and abnormal times. Taking risks, making those kind of decisions is a science, and we felt that it is necessary to start educating and training these kind of leaders.
But how is the emdrcm program different from the other similar programs in other schools?
Oh, well, there are many programs available elsewhere, and they're excellent. They're creating that kind of technical knowledge, how to make decisions using data, using information, using science. Our program is very much couched on leadership. And how do you create that kind of holistic manager that knows how to make policy, but also how to get it done, and then integrate on the ground. Integration is the name of the game. How they will go back to their own institution and build the competence internally, but that's only the first step. The second step is how do I bridge the gap working with other agencies on the ground when there is a crisis.
Right. And so this activity that the emdrcm is doing is part of bridging the gap.
Correct.
So we're trying to add to the conversation, not muddy the waters further. Now, we're going to go deep dive into the topic at hand.
Yes, Wally.
And COVID-19 is something that a lot of us are closely monitoring because it's been creating such a scare across the different sectors of society. So, being a medical doctor, can you run us through the complexity of this particular problem that we're facing?
Yes, Wally. Medical science have informed us that we're dealing with a new novel coronavirus that was discovered last year, and this originated in China. There has been some movement and transmission outside of China, where now countries around the world are having it. But one has to look at it as like treating a flu epidemic, and that it can be transmitted from somebody who is sick, who has gotten it, and then pass it to somebody else. And the symptoms are very much similar to what we would find in flu. There will be fever, sneezing, coughing, sometimes dry throat. In the worst scenario, one might get pneumonia, but we know that not everybody will go get pneumonia. By and large, people who will recover. And there is no medicine at hand, no vaccine to manage this situation yet. So really, there's really no need to panic or be scared. The principles of public health and hygiene has to be applied here. Now, we understand that many countries are instituting this already. First is public health and hygiene. Wash your hands. Don't touch your mouth and face if you happen to be outside and your hands are not clean. Social distancing, avoiding people with cough and colds more than a distance of 6 feet. It's not always necessary to wear a mask. A mask worn improperly may actually become an incubator for infection. But certain countries already impose travel restrictions, and that's precisely why it is important in our discourse to understand how do you maintain societal function. And one of the things we teach in class is how do you build resiliency.
But Doc, this is not the first time that the world has seen a pandemic.
No, on the contrary. Thanks for that question. If you go back in history, if we go really, really back in history, in 1918, during the First World War, there was the Spanish influenza that has affected globally in many countries around the world, and people in fact have died because of that. But mind you, at the time, the hygiene practices were very different from what we have here, and understanding the mode of transmission is now very different from what we understand. So, but and epidemics or pandemics, and by the way, this is not a pandemic situation.
This is not a pandemic.
But epidemics and pandemics have come in cycles of years, and if you recall recent history, in 2003 we had the SARS that affected, and that was like a pandemic. But we weathered that, and it is a form of coronavirus as well. Secondly, we have the MERS-CoV that also came in, and that is a higher case fatality rate, and originating from the Middle East, and that people are keeping an eye on that as well. But what we're dealing here is relatively new. The science have said that this likely came from a livestock or zoonotic disease that has jumped to human, and human now have.
But that has not been verified though.
Yes, but most likely that it would probably be originating from some.
So just to reiterate your point, compared to the other outbreaks that we have been familiar with, like the Ebola, SARS, MERS-CoV, COVID-19 is relatively less fatal.
Yes, in fact, of course, when we say that, we have to look at the denominator.
Okay.
Now, the denominator may change, but currently it's less than 2%. If you cover the worldwide data, the number of deaths compared with the number of people being affected, compared to SARS, is relatively low. We have conferred with scientists, and they said that, if you recall, SARS had a case fatality rate of 10%.
10%.
And MERS-CoV
COVID has 2%.
COVID is the 2 or less than 2%.
Less than
So I said the numbers may change over time. It's not a cause for alarm. We know now that the people who may get pneumonia are the people who are immunocompromised, who have other medical problems. They may not be taking good care of themselves, and for some reason, superimposed bacterial infection may come in. That's why it requires now antibiotic treatment. But they do recover. In many cases.
That's, I think, one of the things that are not really focused by the news that are coming out. People are recovering from COVID-19.
Indeed.
And for example, in the case of the Philippines, I read a report from the DOH that of the initial people under investigation, some of them have already gone back to their respective lives and continued working.
Correct. I think people have to understand that, the public has to understand that when you say persons under investigation, it doesn't mean that they have the disease. They might have been exposed and put in a situation where they are quarantined for a period of 14 days, and they're undergoing some laboratory testing, but it doesn't mean that they have the infection. They might be suspect because of certain criteria. They came from a certain high-risk geographical area. They have symptoms, but our clinical scientists have told us that, by the way, this is the adult influenza season, and they're getting infection like influenza B, but negative for coronavirus. So I think people tend to jump to conclusion, and that's unfortunate. I think people have to ask the right questions, saying, okay, people under investigation are not actually patients. And sometimes the media tend to sensationalize things. They would say the deadly coronavirus, but in fact, as you know, we just talked about it earlier, that the case fatality rate is 2 and less than 2%.
But how would you explain the quick spread of the disease?
All right. Now, compared to SARS, historically, with SARS in 2003, people were not using social media that extensively.
Okay.
And now we're seeing social media being weaponized. People are posting things that are unvalidated, unchecked, dubious sources. Some have half-truths, and they would use the cover of authority of another name, but actually those are information that have not been verified. So I think if there's any lesson to be learned out of this, I think we need to create some level of code of conduct among citizens and society that while information is power, spreading wrong information is a disservice to our society.
And it's very dangerous.
It is very dangerous. It's creating what is known as the phenomenon of epidemiologic fallacy.
Okay.
Which means that
Quite a mouthful. Can you explain that?
Well, yeah. If you are reporting an event and it may or may not be true, the echo chamber that is created tend to get people to focus on it to the exclusion of other more urgent problems around the world. And I think this might be potentially one of those things. People are so focused on it, and every day as people report it, they're creating news. And news is amplified by people passing it to other people. So we have been told, we've been asked, how do you know if it's right or wrong? Well, there are many ways to tell whether the information that you're getting is correct. Can you name the source? And even medical journals who have published things have to retract their paper because apparently it's not well researched, and that those things happen in medical research.
For COVID-19, where should people get their information?
Right, that's a very good question, Wally. And my advice is to just follow the International Health Organization called World Health Organization, where they would then collect global data, curate it, analyze it, and then put forth what is been validated. And what is not been validated, they would have a caveat saying so. But it doesn't mean people need to jump to conclusion because the facts have to be checked. Of course, the other source of information, depending on where you are, what country you are residing, you follow your national authority because otherwise you might get conflicting information. To name a few, I can cite that initially there was a comment about being asymptomatic, meaning to say a person who may be exposed might be carrying the disease but show no symptoms at all. And symptoms, as we know, can be fever, cough, sneezing, muscle.
So they might not have the symptoms, but they are carrying of the virus.
And that was reported, maybe in good faith, but later in hindsight, in retrospect, when they investigated the matter carefully, the so-called asymptomatic person really had symptoms to begin with. So I think that has been debunked. The second was a story about the virus can be airborne, and that has all been discussed and proven that in fact it is not airborne. These things that are passed, people want to err on the safe side, not knowing that it may not actually be true, and that might change policy in terms of hygiene, public health, protection, and the like. So again, my advice to the public is, of course you can pass information around, but we need to exercise responsibility in what information goes out, where it came from, is it validated, what kind of impact will it create, is it an opinion or is it truth? And I think scientists have to come forward with more responsibility in declaring what they know. Now, sometimes it's done in good faith, and there will be news like, some groups are researching on a particular drug.
And they want to help.
They want to help, but not realizing that it is fueling
more confusion.
Confusion story. For instance, there are stories that some scientists are looking at antiretroviral, anti-HIV drugs that can be used in being a virus here as well. Of course, these are all undergoing some studies, but nobody has any conclusion yet whether it will work or not. But what we know when we confer with our clinical scientists, they say that the majority recovers. They recover. So what they have seen among the susceptible are the immunocompromised, people with medical illness, the elderly, perhaps people who are smoking are put in their defense will probably go down a little, and therefore might contract it readily and get into infected states. What else do we know about this the virus is that social distancing may help. Droplets that come up from the mouth of the person who's infected.
I'd like to cut you off there, Doc, because when you say what do we know about this, the World Health Organization claims that they also have limited information about the virus.
Because this is something new.
This is something new.
And things are unfolding. Yeah.
And I think that's also why they're quite careful in making any pronouncement. You mentioned earlier, this is not a pandemic.
Yes, this condition that we have now has been declared by World Health authorities as a public health emergency of international concern, but has not fit into the criteria of a global pandemic.
Mm-hmm.
But it doesn't mean that the countries will have to wait the pandemic to prepare for it.
They have to start preparing now.
We have to start preparing for it. In fact, if you look at many of the stories of the past, we have always been told it's not a matter of if, but it's a matter of when. And we know that by the biologic cycle of infection, there will be times when pandemic will happen. How we react to that situation, how we prepare for it, how we manage business disruption and societal panic is part of the responsibility of everybody, not just the government.
So everybody in society has a role to play.
Definitely.
Okay, so
definitely.
Just to clarify with those watching this live streaming, what is the relationship between the WHO and the local government, the local health authorities?
Okay. The World Health Organization is an instrument, an agency focused on health under the United Nations, and they have over 190 member countries, and they follow the guidelines of the WHO. They contribute to the mandates of the WHO by discussing global health issues, and the guidelines that are set forward in a scientific manner by World Health are curated by scientists, and these are now shared with their member countries.
So they provide guidelines for local authorities to implement?
Well, the local authorities can come up with something on their own, and even sometimes even stricter if necessary, but one has to look at local context, and national authorities by and large do follow the best practices applied globally.
So for some people who might be asking, do I believe the WHO or do I believe the DOH? What would be the right response?
Oh, I think they are resonant.
Okay, they're resonant.
Yeah. So I think earlier you were mentioning that the Director General says something about the Philippines.
Yeah, in the briefing that they shared about the mission of the COVID-19, the Director General mentioned that there are 9 countries which has so far not manifested the new case in the last 2 weeks, and the Philippines is one of them, which in my head seemed to indicate that we are doing something right, at least in the prevention space.
One might come to certain conclusions with that respect, but I think the question the conclusion there is that there's no local to local transmission. And
just to clarify that, meaning the 3 that have been confirmed so far,
we're not able to pass it on to somebody else. Okay. And most of the cases persons under monitoring or investigation are coming from high-risk geographical area, and for which testing is being undertaken. And there has been no local-to-local transmission. The cases so far, as we know, fortunately, in our local context, has been, shall we say, imported. But if you ask me, for instance, why is it so in our country, one may have to look and dissect the issue into how do you create a health system that is mutually supportive of each other. As you know, the local mandate of a national authority on health would be check the borders. So travel restriction to high-risk areas have been implemented. There's quarantine. When people come in, you check them, you quarantine them, you are able to do contact tracing. So that's another area of public health epidemiology work. And then giving them support from the clinic, those who detect it and how do we report them is also part of the systems in place. And lastly, how do you strengthen hospital, train the workers, health workers, and the professionals, and how do you manage them within the hospital setting is the last defense. So if you look at it, there are many gauntlets, defense, as we say, in order to protect a country, and those have to be working in sync with each other. Perhaps it explains why we are able to manage this in such a way.
Well, you being a doctor yourself, Doc Ken, how would a normal doctor feel about being asked to manage or attend to somebody with a potential virus like COVID-19?
So I think, well, doctors have to step up. I think they should not be afraid. There are, personal protective equipments and clothing that one needs to use. It's part of the risk of being a medical worker. It's just like taking, it's leadership. Public health and clinical medicine is an exercise of leadership. It's not given to everybody, but once the opportunity is there, we have to step up. This is part of a social service, public service, not looking at remuneration or compensation. In these kind of cases, our advice to the public is to support your frontline workers, the responders, the people who are making tough choices.
Right. And one way of supporting our medical professionals is making sure that there are masks that they can use to prevent the spread of the virus to themselves.
Yes.
Because one of the global impacts that this care is creating is that people are hoarding or buying too much supply of
That is true. I think the public scare has taken a life of its own. In fact, there is no recommendation to wear masks.
Okay, let's just highlight that point. There is no recommendation to use masks, except if you have
symptoms, and mostly if you have symptoms, why go out and stay at home and recuperate, recover from it? Why go out and then take some risks? But if the mask wear incorrectly may actually be a petri dish.
Okay.
To attract infection
it creates
elsewhere.
more harm than good.
So
if you do it, if you use it wrongly.
Correct. So the mask is to be wear correctly, and there is no recommendation to wear it, and these are reserved for individuals who are working in a high-risk environment with potential for infection and reinfection. Social distancing is practiced as well, so that and hand washing. If we were to practice our hygiene and public health practices more ardently, then we would cut down on a lot of other infections as well.
So some of the things that's supposed to help us out are things that we ought to have learned way back in grade school.
In fact, one of the questions that have been posed before is people are worried about all this, and when we ask them, well, did you even get your annual influenza flu shots? And they say no. So, meaning to say, there are modalities and opportunities for them to beef up their immunity. The annual flu shots are done in every year, and the strain do change. This year, I think influenza B has been the predominant strain, and you'd be surprised that people don't even know that they need to take annual flu shots to prevent them. And it's not specific to coronavirus, but then again, the practice of getting yourself protected doesn't seem to resonate until it's too late.
I think many people are also of the mindset that I'm healthy, I'm young, there's a little chance that I will get this, but getting yourself vaccinated is one sure way of beefing up.
Because we know by epidemiology and science it works.
Okay.
The other message I think we should inform the public is don't self-medicate with antibiotics.
Okay.
Because antibiotics do not in fact work
Because they are for
bacterial
infection.
And there is no direct treatment for supportive symptomatic treatment, but also important to monitor for symptoms and complications, one of which is pneumonia, and pneumonia has to be treated properly by a trained health professional, so not for self-medication.
And with all the communication technology available today, it's not that difficult to go and reach out to your health professional.
Indeed.
Right? So there should be no excuse for you to reach out when you start getting all of the symptoms. Doc, I'd like to focus now on the business side of this health situation. China, that's been badly affected, is understandably the hub for most manufacturing companies, and a lot of companies worldwide are suffering because parts from the manufacturing sites in China are no longer getting out. And it might not be because these products are contaminated, but more because facilities are shutting down because people are no longer going to work.
Correct.
How do we cope with this when our businesses, for example, are dependent on raw materials coming from China?
Right. Globalization, trade globalization is a buzzword for many years now, and I think people would look for the most cost-efficient way of doing business, where you get the best material for a certain cost. But we encourage business to always put in place what is known as BCP,
Right.
business continuity planning, in case for such a problem such as this, with disruption in their supply chain, it is best to be able to find another source quickly. Otherwise, this is in effect one critical part and material that feeds into the value chain of another company's business, whether that be service or creating another manufactured product, would damage the economy. So people might not be able to work. There might be no essential goods. We have made an assessment of society, and in the past, while government was tasked to provide basic goods and services, now we are seeing more and more private sector taking the cudgels of providing services and goods. And business continuity planning is really part of how do you maintain the business operation, particularly if they are supplying vital things, telecommunication, water, electricity, hospital services, pharmaceutical, even food.
Right.
Those go into the grocery. How do you protect your workers? How does the supply chain move logistics? And how do you get paid in order to maintain the normal function of a society? And the same is true for business continuity, and we're studying that in fact in our class. How do you build government resilience by government service continuity? And the two strategies have to match in order to provide geographically area-wide resilience.
And to keep society moving forward.
Correct.
One thing that I've observed sometimes, because of the fear, people are afraid to go out and live their normal lives. And that's the sad part, because with the fear that's being created, a lot of the effects are because of people's fear that's incapacitating them, not because the conditions themselves are preventing people from acting.
That's true, Wally. I think while there is a segment of information that is not complete, but being paralyzed by ignorance and unhealthy skepticism is not going to do us good.
Right.
And that's one of the things we want to teach our society, to ask the right questions, seek the right advice. Don't believe everything you read and hear. There is a story behind that story. Follow international health authorities' declarations and their advice. I think we will not go wrong.
Okay, so Doc, this question is quite difficult to answer. What would be a worst case scenario?
I think the worst case scenario might be a pandemic, which is not yet, but it doesn't mean that we should not prepare for it. We should be ready for certain business disruption and create resiliency in our organizations as well as society to deal with it.
So how would a private organization go about preparing for that worst case scenario?
All right. In many of the business continuity planning is to make certain assumptions.
Okay.
The assumption will be guided by knowledge and science. How many people are going to be sick? They may not be able to come to work. And is your work critical in the chain of events in the society where you operate in terms of providing service or a good? Is it all right to shut down? If you shut down, then how do you deal with your most precious commodity, which is your human resource? How do you fend for them and take care of their families? Will they be able to come to work? So will transportation be necessary? Are there facilities that you could put in place for them to be able to work from home and still continue your enterprise? But a lot of this is really couched in good assumptions by working closely with government,
Right.
which is, by the way, what our program is espousing.
They cannot do it on their own.
Oh no, impossible. It would be it would be difficult if you were to do it on your own, because we don't live in a vacuum. We live with interacting with
Right.
other agencies, and this is what we teach to understand the complexities. And sometimes it's not just process, legal process, financial process, but also human-to-human interaction. And that's one of the leadership courses that we manage here. How do you deal with other people to create that kind of community resilience?
So it's one sector working with another sector to ensure that everybody benefits from the resilience program.
There's a utilitarian principle to be upheld here.
So in the way that you've been evaluating the development of the COVID-19, Doc Ken, would you say that we have improved a lot as a country, as a nation, in preparing for outbreaks like this?
I guess you can say yes, but it doesn't mean that we have to let our guards down, because the name of the game really is continued vigilance, continued surveillance and monitoring, and putting in place rational policy that benefits everybody.
Okay. And that requires also constant dialogue from across stakeholder groups to get to feel what they're also thinking about, what their concerns are.
Yes, and I think one of the things not always mentioned is that sometimes people have to make some sacrifices. Because at the end of the day, it's for the common good and for a longer term benefit. And sacrifices will have to be made.
Okay. So with the discussion on COVID-19, we'd like to ask a couple of reminders that we need to give out to the public as much as possible. What do people need to know in order to prevent themselves from getting sick with the COVID-19?
All right. First thing to do is to make sure that you're healthy. If you are sick but needs, sick of other conditions, make sure that you are consulting your health professionals and taking your proper medications to maintain your health. Avoid risky activities.
Risky activities meaning?
Well, going to places where you might potentially catch infection, but that has already been in a way managed because of the travel restriction.
Right. Okay.
The importance of adhering to news that is accurate and correct. Don't believe everything you read. Always ask questions and be skeptical. But there are sites that you can go to learn more about this thing, and I would recommend the World Health Organization as well as your national authority will be the best source of information. Practice hygiene, hand washing, social distancing are some of the few tips that we like to recommend people to do, and make sure they don't pass fake information.
Right. And for a list of some of the fake informations that have been spread, check out the myth that's been explained and debunked by the WHO in their website. So on the last note about communicating to the public all these risks, how would you assess the society or the Philippines' efforts to communicate the risk about COVID-19?
I think we're doing it all right. I think there's a calibrated response. People are not in a panic, but those panic that we see are mostly because of the social media,
fake news that's been
spreading around, creating an echo chamber panic. But actually, there's people do recover from this illness, and for those who get a more serious event like pneumonia, there are ways to manage it and get to be treated.
Okay, so we just had Dr. Chen talk about COVID-19, but I have one more question that's not about COVID-19, it's more about the NDISM program. Do you talk about disaster all the time in the NDISM program?
No,
Is it a class that's always sad and gloomy because all we talk about is disaster?
No. The program focuses on management tools, mostly culture leadership strategy. How do you integrate and collaborate to find solutions and make those risky solutions that ordinary people cannot make? And these are the kind of people we train, the cadre of executives who sees things from a bigger perspective, but also knows how to manage tools on the ground. So crisis, unusual events, man-made situations are also things that we discuss in class. And we are a class that is producing solutions. If you recall, during the Taal eruption in January, the class was suddenly changed into a functional laboratory. We run a prototype operations center where the classmates all come together and we're dealing with real-time issues.
And it's in my head, it was such a surprise development. I've done my graduate school before in another institution, and whenever there's a calamity, business is either as usual or they suspend classes. At the AIM, during that particular class week at the height of the Al eruption, the classroom was transformed into an operations center. And hats off to you, Doc Ken, for leading that.
It was a team effort, wasn't it? And it was a learning laboratory.
And we will have another discussion about the Taal project and the data initiative that has been brought forward because of that. But at least for those of you who are now watching this live stream, you've heard from the big boss of the ZSDM about our emdrcm program, and maybe you can also consider taking on this program for your development, for your personal and professional development. So who is this program for?
Oh, this program is for leaders.
Leaders.
It's not for disaster.
Is it for government leaders?
Oh, it's not just for disaster practitioners, but for people who understands risks, who can reach the issues of dealing with people, with finance, creating a strategy, making it work, applying design thinking, social systems thinking, critical thinking, in coming up with innovative solutions and using innovations and technology into the program. And so this is for anybody who fits the description of working in resiliency and risks in corporate setting, in government setting, decision makers. They are people who are regulators, people who are involved with in academia that can share the knowledge and translate it to other people to be prepared and build that resiliency. Military sector, we welcome them very much because they are people who understand the difficulties of working in different scenarios, and it's a learning opportunity. We have classes, we have laboratory, we have field trips. We create a product of value and then we test it.
Right. And for those of you who are inclined to know more about the program, I have given a list of information you would like to consider. So for information about the program and the sister program, the MDM, Master in Development Management, you can reach out to Angela through number 0977-169-5144. And there are activities lined up. That's also a part of the effort to reach out to the public and tell them about what we're doing. There is a road show coming up March 12 to 14 at the Calabarzon area. March 12, Dasmariñas, Cavite. March 13, Malvar, Batangas. March 14, Santa Rosa, Laguna. You can check out this Facebook space and know more about the activities that we're doing. And lastly, this coming March 12, we are putting together the Resilience Leaders Forum focusing on women leadership for social impact and disaster resilience. So thank you for spending time with us. This has been the first episode of emdrcm Live. Count on more interesting topics to come your way as we journey together, trying to build a more resilient Philippines that all of us can really contribute to building. This is Wally Panganiban, and again, thank you, Doc Ken, for your time.
Thank you,
and keep up the great work.
Thank you, Wally. Goodbye.
Goodbye.
No more.